Hey, my name is Dr. Dave Harvey. I'm a board-certified dermatologist and Mohs surgeon practicing just outside of Atlanta. And I'd like to talk today about how PatientPoint has impacted me and my patients in performing Mohs surgery. Let's take a closer look. PatientPoint has a lot of wonderful content for Mohs surgery. Let's dive in to see how I actually can use this. So you can preload a lot of this content and where it says for clinical staff, so we'll do that here. These can be saved. And then you can go to, for example, the Mohs procedure, showing a patient how Mohs is performed. So here we see the actual non-melanoma skin cancer. We're numbing the area with local anesthetic. That's depicted here. We usually tell the patients that doesn't hurt because we can buffer it with lidocaine. And then we'll do multiple layers to clear the cancer in a tissue-sparing way, which achieves the highest cure rate. You can even go into a higher sort of visual here with a more zoned in kind of look to show actually tumor and the layers of the skin really well presented. So again, very powerful impact for the patient and helping you to explain Mohs surgery. So your patient has just had Mohs surgery done. They have a defect, and let's pretend that that defect is on the nose. So there's a couple of ways you can explain to the patient how you really want to approach their reconstruction, and this shows a valid way on how I integrate my own before and afters to make the patient feel comfortable with me, and also to explain why we cut more than we need to when we do the repairs. So the first thing you can do is hit on healthy anatomy, and if it's a female patient, you can hit this head female image. It'll load it, and what we basically can do is rotate the photograph in this way, counterclockwise or clockwise, depending on what part of the nose you're looking at. Well, for this illustrative purpose, show the left side. So here we have the defect. We'll say it's just above the nasal ala, right there. Now I explain to the patients they have a defect there. If I just bring that skin together, I may pull up on the nose. So this illustrates why we have to cut more. In this instance, I'm going to show how we can do an advancement flap. So here we take the Burroughs triangle above, we hide it into the alar groove, and we're going to take out a Burroughs triangle inferiorly and then shift it over. And I explain to the patients that we're maintaining cosmetic units and that the final repair will look something like this. But the reason we do this is to give them the best cosmetic outcome with less visibility, as opposed to just bringing the wound together. And then I can illustrate even more powerfully how my before and afters might look. So in this instance, I'll just pull up one of my before and after pictures off of my website, which by the way, you can load. So let's show how you can demonstrate your own personal content on PatientPoint. So this is an example. So I went to my office updates and I'm gonna pull up from my website before and after pictures. They're blurred out intentionally, but you can actually utilize these to kind of discuss with the patient why you're repairing a certain way, and then they can get a feel for your skills. So here we see, for example, the advancement flaps. So that same advancement flap on the nose that I just showed you, I'll take you to a before and after of my particular repair and how this could be sort of reinforced for the patient. So here we have that photo. On the left, you see why the suturing is carried out the way it is, but what really is impactful was when the patient sees the 3-month post-op photograph to show that those rationales made sense and what they might look like after surgery. You never want to promise that, but you have established the confidence with the patient by showing these.